To Your Health, where we talk to local health leaders to help you feel better, live better, and be better.
Hey there, everybody, and welcome to Your Health. Well, today I'm joined by Dr. Clint Olson from St. Gianna Clinic. Doctor, it is great to have you.
Thanks so much for having me.
Yeah, for people unfamiliar with St. Gianna Clinic, maybe we just do a rundown of some of the things you guys are known for, you like to see people for.
Yeah, I'm really excited to be starting at St. Gianna Clinic. We see patients for OB, fertility care, pediatrics, and family medicine with providers like myself. And we love seeing families as well as individuals all the way from birth to the end of life.
I maybe want to double click on the family medicine part because that is a great entry to have a relationship with a doctor. Let's talk about your approach to family medicine.
Yeah, family medicine is like the front door into the healthcare system. So we see pretty much everything, but for the most part, oftentimes visits are for preventive care, managing medications like for blood pressure, cholesterol, diabetes, weight loss, and yeah, that's the majority of family medicine.
I know when we toured St. Gianna Clinic, things are done a little bit differently there. Maybe we should address that.
Yeah, St. Gianna Clinic, we really try to care for the whole person, body and soul. We know that your physical health is very much connected to your mental health, your emotions, your spiritual life, your community, your family life, your work, diet, and your activities. So I really try to know my patients and all these aspects of their life so I can care for the whole person.
Yeah, that 360 approach is fairly unique instead of get in and get out. So we're here, we're talking to a doctor, we got 20,000 people here watching. What would one thing you'd want to say as a family doctor to people watching right now?
Yeah, well, the American Heart Association has recently come out with their latest recommendations for cardiovascular health. And this is evidence-based medicine, which is for prevention of heart disease, which is the #1 killer in our country right now. And they've come up with a lot more robust data with millions of patients over a much longer period of time. So we can calculate not only your 10-year risk of heart attack and stroke, but your 30-year risk. And we can also start assessing your risk at age 30 now as opposed to age 45. So we can really get you on a good plan a little sooner. And as your family doctor, I can help address your blood pressure, your cholesterol, diet and exercise, weight loss, and all these things to lower as much as possible your risk of heart attack and stroke.
Got it. Get in early, get on a good path. All right, Doctor, thank you so much for being here at St. Gianna Clinic, right off of 41 in De Pere. Thanks for being here.
Thanks for having me.
And we want to thank you for watching To Your Health.
The preceding was a paid advertisement.